November is Men's Health Awareness Month, and Boston Scientific wants to raise awareness about a potential side effect of prostate cancer treatment. It impacts 1 in 10 men after their operation. We're talking about stress urinary incontinence. And Dr. Leroy Jones with Urology San Antonio is a board-certified urologist who specializes in treating men's health conditions. And he joins us today with what you need to know. Thank you for being here, doctor.
Thanks for having me.
All right, so for those who aren't familiar with it, what exactly is stress urinary incontinence?
So stress urinary incontinence is if you increase your intra-abdominal pressure, if you cough, sneeze, laugh, you'll get a squirt of urine. And obviously that's not appropriate, and so it's quite debilitating to patients as far as their quality of life.
So what causes the condition?
So you talked about prostate cancer treatment. So some prostate cancer patients who undergo surgery, their external urinary sphincter muscle, it may not work properly after the surgery, or maybe it's damaged after surgery. Now, significant incontinence is about 4 to 7% of patients that are going to need treatment for it. So fortunately, there is treatment for it.
And so you've mentioned the treatment. How can it be treated?
So there's 2 types of treatment. A lot of it depends on the severity. So if it's mild incontinence, they don't leak very much, and we usually kind of grade this by pad use. Maybe they're a candidate for what's called a male sling. It lifts the urethra up to give it a little bit more support. And then the other, for more severe incontinence, moderate incontinence, we have what's called the artificial urinary sphincter. And that's like a blood pressure cuff that goes around the urethra, and the patient has to control the unit. They still get the sensation that they need to go to the bathroom, but they need to control the unit, squeeze a little pump, the cuff opens, they empty their bladder, and then the cuff closes by itself. So the artificial urinary sphincter has been out for close to 50 years, which is amazing, and there have been some great developments and modifications of it, and there's some better things that are right around the corner. The male sling has been out for, I want to say, probably about 10 years or so, and we get excellent results from that. So we pick the treatment based on the severity of leakage.
Okay, and so what are the risks involved with the male sling and surgery procedure?
Sure. Well, first of all, it's an operation, so it does involve general anesthesia. It's done in the hospital, but they're outpatient surgeries, and the procedures are all less than an hour. The male sling, the effect is more immediate. The artificial urinary sphincter, you don't activate it until later. Because it's a foreign body, there's always going to be a risk of infection, but it's low, 1% or so. So really, when you look at the risks and the benefits clearly outweigh the risks, because leakage of urine is very debilitating emotionally, and it really limits the activity of the individual.
Of course. All right. Dr. Leroy Jones is hosting a free webinar on male stress urinary incontinence on November 11th at 6:30 p.m. To register, text webinar to 72345. The webinar is sponsored by Boston Scientific. For more information, just call 210-972-6565 or visit the website fixincontinence.com.